Painful varicose veins can slow you down, but they don't have to keep you from the lifestyle you've had or want. Dr. Carroll Overton joins us today and is going to talk about the common symptoms and treatment options for varicose veins. Dr. Overton is a vascular interventional radiologist, and he's also the director of interventional radiology at Wake Radiology. Dr. Overton, thank you for joining us today.
Thank you for having me.
What are some of the symptoms of varicose veins?
Well, symptoms are varied. A lot of patients come to us only because they're concerned about how their veins look. Others come to us because their legs hurt or cramp and often are bothering them clinically. Other patients come to us because they have both. They have pain, cramping, sometimes swelling and burning, but they also are concerned about how their legs look with the dilated veins that they have. So we see a whole spectrum from just unsightly veins to the clinical symptoms of pain and whatnot.
What are some of the causes of varicose veins?
Well, varicose veins are more common in women, and a lot of that has to do with, one is childbearing. Once you have a pregnancy, that will tend to compress the veins in the pelvis and make the leg veins more susceptible to dilating. The other is heredity. A significant percentage of people who come to us say that they have a mom or a dad or siblings who also have varicose veins. So it's variable person to person whether or not they have heredity or some underlying clinical issues such as childbearing in the past. And that's why women have veins much more commonly than men.
Okay. Can you tell us a little bit about the procedure?
Sure. Well, the first thing we do is someone has concerns about their legs or their veins, they'll come see us, and we'll see them in the clinic. We'll sit down and look and have them show us what it is they're concerned about and tell us about their symptoms. And we'll determine then is it spider veins that they have, or is it really venous insufficiency? And that helps us to decide which route to take to work them up. If they are truly venous insufficiency, that's a term we talk about when a major vein in the leg has valves that no longer work correctly, and that's the saphenous vein. And then if that's the case, we then go through a process of performing ultrasound to determine how the veins are functioning in the legs. And if we find that it is indeed venous insufficiency, we start the process of 3 months of management where we prescribe compression stockings. Tell folks to try to elevate their legs when they can and utilize ibuprofen and other non-steroidal anti-inflammatory medicines to help with their pain and symptoms. If 3 months go by and they're not any better, then we can talk about the procedures we do to help alleviate their symptoms from that point forward.
What can patients expect after they have their varicose veins treated?
Well, for those who have venous insufficiency, we do what's called laser ablation, and that typically is a procedure that in the old days requires stripping. And because the only way we knew how to get rid of the saphenous vein was to pull it out. And now we can get rid of that vein through a small nick in the skin below the knee, just basically an IV, and through that the laser goes and ablates that vein that is problematic. That way we don't have to do surgery to take that vein out. That procedure takes about 20 minutes, and it's covered by insurance when it's medically indicated, which it usually is, and there is no downtime afterwards. The only true limitations we tell people are for 2 weeks after the laser is no long-distance traveling and no real heavy, strenuous activity. And we actually encourage people to be active. We don't want people to be debilitated.
Does a patient need a referral from their primary care physician?
They do not. We see a mix of patients, both referred and those who hear about us and come in spontaneously, so it doesn't matter one way or the other. We're happy to see folks who come straight to us, maybe because they heard about us in an ad or from a friend. But we have a lot of patients who come to us because their physician, during their routine exam, sees that they have symptoms that are worrisome for varicose veins, and they are referred to us.
Okay. Now, earlier you discussed briefly spider veins. Can you tell us a little bit more about spider vein treatment? Sure.
Spider veins are typically what we call cosmetic. And spider veins are most often unsightly, but can have some burning and tingling associated with them too, but most often cosmetic. The big difference with venous insufficiency is that spider veins are not covered by insurance because they're deemed cosmetic. So we have specific hourly rates to treat them, and treating them now is better than it's ever been. Unlike the old days of saline injection that burned, the new ones don't burn. And it's through a very tiny 30-gauge needle, not much more than a mosquito bite. And sometimes it takes 2 or 3 treatments to really get those veins to go away. And once they are gone, you don't have to wear the compression stockings anymore, and people tend to be very happy with the outcome.
Excellent. Dr. Overton, thank you for joining us today.
Thank you for having me.
To learn more about the topics Dr. Overton discussed today, and to learn more about the Carey Vein Center, visit our website at wakerad.com. You can also schedule a vein consult at wakerad.com.